Well, a warm welcome back. Still Friday the 17th of September. Now I want to look at comparing the UK now to last year and thinking ahead to next year, the implications for that. And we also want to look at some updated COVID symptom tracker data from the Zoe app, the Tim Spector Group app as well. But before we do that, I just want to clarify something from the last video. Now, we saw that the vaccination rate in Idaho was about 40%, whereas the vaccination rate in the rest of the United States is about 54%. And we said that had the vaccination rate been as low in all of the United States as it had been in Idaho, we would have expected the increase in growth in cases, deaths and hospitalizations to be the same throughout the United States as in Idaho, had the vaccination rate been 40%, for example. And I meant to show you some evidence for that because we did look at this the other week. So this was the paper from the Centers for Disease Control. And this was the summary credit card or poster that they give, which is remarkably useful and just hardly requires comment, really. But after the Delta variant, people that are fully vaccinated are 5 times less likely to get symptomatic infection, 10 times less likely to be hospitalised, and 10 times less likely to die. So that difference between 40% vaccination in Idaho and 55% vaccination in the rest of the United States as what has put the Idaho hospitals, or the main factor that's put the Idaho hospitals into crisis measures. It really is quite ominous to think about it in those terms, and it just shows how grateful we have to be for the vaccines that we have. Now, I want to start off now with the UK, comparing, these are witty slides from a few days ago, the UK over 2 seasons. Now, this first one is cases. Now, what we have here is these are the cases in 2021 and these are the cases in 2020. So at this time of the year in 2021, we've got a lot of cases. At this time of the year in 2020, we had a lot less. But we had this great increase in autumn and then into the winter. Now, we don't think we're going to get that similar kind of increase here because of the high immunity levels, or the relatively high immunity levels in the population. But it does show that this time last year, this time in 2020, we were at pretty low levels. And then the autumn had a pretty dramatic effect. And then this was the effect here that we saw from the Alpha variant. Now, of course, we don't know if we're going to get some other variant that's going to cause similar problems, but we think it's very improbable that that will happen. But it does show that we're starting from a much higher base of cases this year compared to this time last year. But given that well over 90%, it's about 95% of people now have some immunity to this virus, I'm not expecting the trend lines to be anything like, although we are expecting cases to go up until Christmas time. So for the rest of this year, cases could well go up, with hospitalizations and deaths, unfortunately, in the UK. But after that, it should be better. But it shouldn't be as steep as this line here that we see from 2020. So that was the cases in 2020. Then if we look at the situation with hospital admissions in 2020, so, well, again, this is the hospital admissions now, around about 1,000 a day in 2021. This time last year, we were only looking at a couple of hundred cases a day. And yet the 2020 year went up quite steeply with the autumn and with the Alpha UK Kent variant. We're not expecting it to do the same, but it does again show we're starting from a much higher base of hospital admissions for the time of year. For the time of year, we've actually got pretty high numbers at the moment for this time of year, given that we're going into autumn, given that the schools are going back. And then I think this one looks at deaths. Yep, this one looks at deaths. So again, we see the death rate here in 2021, much higher than the equivalent death. The death rate was at the equivalent date or month of the year in 2020. And again, we see this rise from autumn and the Alpha variant. This should be fairly dramatically different for the remainder of 2021 because of the large level of protection just given from the vaccines, as we've seen. People approximately 9 or 10 times less likely to be hospitalised and less likely to die. So the vaccine should make sure that this line stays reasonably low, even although the cases line may go up and the hospitalisation line may go up. So just interesting to compare the two seasons, and next year I'm expecting it to be much better. Now here's the current prevalence on the Zoe Symptom Tracker app. Let me just show you that now. So what are cases doing at the moment? Well, they're kind of up and down a bit, aren't they? So they're kind of going down a bit now, but they're basically kind of levelish. So that's the symptomatic prevalence in the UK at the moment. And this, of course, is live, actually a few hours ago, but this is live data. But what I want to look at now in a little more detail is the data from the COVID Symptom Tracker study. This was released yesterday on the 16th of September, but it's data in detail up to the week of the ending the 11th of September. And the thing I really love about these data sets is there's about 1 million people reporting a week, and this is based on PCR and lateral flow test data for the week up to the 11th of September, but it's 32,409 people. So these are really good sample sizes that are still complying with the COVID Symptom Tracker app, which is great. Now, there was an average of 47,276 new symptomatic cases per day for the UK in the week, but that was down, as we've just seen, from the previous week. It was down 9% actually, when it was 51,876. So a fairly encouraging reduction in that week. New daily cases in the fully vaccinated. Well, fully vaccinated people were getting a lot of symptomatic cases. 15,493 people fully vaccinated became symptomatic. But the previous 7 days, it was 17,674. So it was down a bit again. And of course, people that are fully vaccinated, typically their symptoms are less severe, fewer of them, don't last as long, and less likely to result in hospitalisation. But still doesn't alter the fact a lot of fully vaccinated people are getting symptomatic infection. Once they've had the symptomatic infection after that, I would expect that to give their immunity a really quite a serious boost, and would think that most of them will be fairly well covered after that, but we haven't got the full data on that yet, so that's still speculation, but it will turn out to be the case. I don't think there's any question about it, really. Across the different age groups, daily new cases in 18 to 35s down a bit, daily new cases in the 0 to 18s up as schools return, which I suppose you would expect. Across the regions, many areas in England, the cases there are falling or they're stable. So England looking pretty good. And Scotland, although the cases have stopped rising, the hospitalizations are still increasing. So I'm expecting this to improve in the next week or two, but there's no question about it that hospitalizations are really quite onerous at the moment in Scotland. The health services in Scotland are under significant pressure, and of course we have heard particular cases in the news of tragedies that have occurred through delayed ambulances and such bottlenecks in healthcare systems. So it is difficult in Scotland, but hopefully as the rates have stopped rising in Scotland now, well, they've stopped rising, so hospitalisations could stay high for a week or two. So hospitalisations in Scotland still going to be a problem for the next few weeks, unfortunately. Prevalence in the UK at the moment, the overall prevalence in the UK is 1 in 95. That's actually on the week up to the 11th of September, so it'll be a little less now. So 1 in 95 people currently up to the 11th of September had symptomatic COVID. UK R value as a whole going down slightly, but Wales and Scotland. Wales actually going up slightly. Scotland level. So UK as a whole going down slightly. Wales rising very slightly. Scotland pretty well level at the moment is where we are. Long COVID, ongoing issue. Symptomatic people that are developing COVID now that are likely to be symptomatic for more than 12 weeks. Up to the 11th of September, 781 people per day will go on to experience this long COVID up to 12 weeks. And a proportion of those, of course, will suffer for longer. So I'm afraid everywhere there is going to be this ongoing burden of morbidity for the next months. Let's hope it's not years, but for the next months as a result of the proportion of people getting long COVID. And the reductions are commensurate with the reduced symptomatic case numbers. So again, we are expecting these to drop off in the next few weeks as long as the cases keep going down. So calling on this, Tim Spector comments, after calling for a plan for several weeks, I'm pleased to see that the government has launched a booster vaccine programme, and in the UK to give boosters to everyone over the age of 50. And this has already started with carers and healthcare providers that are particularly at risk. This booster programme has already started and they're already getting third doses. It's going to be 6 months after the second dose. So like I had my second dose was in May, 11th of May I think was my second dose. So that'll be May, June, July, August, September, October, November. So I should hopefully be called for my third booster dose around about the beginning of November. The way it's being rolled out in the United Kingdom. What happens to under 50s, we don't know yet. There's no definite plan on that. So Tim Spector commenting on this. To give Bruce, where are we at? The winter plan fails to introduce the current symptoms to the list. Okay, so what he's saying here is the very common symptoms that are being reported to the COVID symptom tracker app, these common cold symptoms, need to be added to the government list to give people this awareness. And for some reason, this still isn't happening. Although some people that do get the infections, to be fair, do still get the fever, do still get the cough, do still get the loss of smell. But Tim Spector saying from his data, now most people experience symptoms like sore throat, headache and sneezing rather than fever or cough. But some do get fever and cough, but he's saying most, so that's what the data is showing. So that is clearly the case. We have to have this index of suspicion. I also don't understand why we are waiting for the situation to get worse and the NHS is pressurised further before implementing simple measures that would help to bring down the number of new cases and save lives. So this is absolutely true. We know that because there's a lot of people have a high degree of immunity, that relatively small interventions like just 20-30% of more people working from home, like universal mask wearing in public spaces, all of these relatively small measures would have a big reduction effect on the number of new cases. And Tim Spector says, I don't know why these simple measures, low cost measures, aren't being taken. And I agree with him completely. With such high levels of virus in the population, we should also still be wearing masks and keeping our distance in crowded public places. Absolutely, we should still be wearing masks. I always wear mine and keep distances in public places. As in major European cities where cases are much lower than ours. So we're getting more cases in the UK more quickly, resulting in more hospitalizations because we're taking less precautions than other European countries. And I really don't know why we aren't taking simple precautions to keep the hospitalizations down. Wearing masks doesn't cost anything. Like Tim Spector, I really don't see the problem there, but we don't seem to be enforcing it at least. Although, of course, it is highly advisory in many situations. So let's look at some of that on graphical terms. So incidence by age group. So this does change a bit. So we see here the 0 to 18s have kind of gone up a bit there, as we've just looked at. The older age group here, the over 75s there, the 55 to 75s there, partly due to vaccine status, partly due to behavioural change. But the 18 to 35 grouping here, we do see that that's dropped off really quite a significant drop off in that age group there, which is good news. Moving on to again Zoe data, incident figures, results over time, total number of new cases and new cases in the fully vaccinated. So what we have here is fully vaccinated people in red, or people in blue, and these are people getting new symptomatic disease in the fully vaccinated. So what we see is that still most people that are getting symptomatic disease are in the unvaccinated group, and of course there are many more people now in the vaccinated group than in the unvaccinated group. So this is taken from a much smaller pool of people, and this is taken from a much larger pool of people. So we still see this great protective effect of vaccination, but we do still see that there are quite large numbers of fully vaccinated people getting symptomatic disease and able to pass the disease on. But good to see that that number is falling off slightly. So we're still seeing breakthrough infections, but compared to everyone, it's still a good level of protection from the vaccines. New cases of long COVID on the 11th of September. Well, unfortunately, there is quite a few cases of long COVID coming along. Good to see that the number's gone down a little bit lately. And we expect will continue to go down if the cases go down. And then this is just the accuracy of the COVID symptom tracker data, which is quite impressive, really. So we've got the Zoe line here, which includes symptomatic patients, of course, and we've got the confirmed cases here. So we see a very accurate mirroring of cases between the two data sets. So there we go. Levelish at the moment, I think it has to be said in terms of cases. And third dose is starting to be rolled out. The Israeli data would suggest that has a very big influence on hospitalizations, and I haven't checked for the last hour or two, but the FDA is due to make that decision about the United States as well. Now, we've been following Wefwafwa on his community health program in Uganda, so let's just see what he's up to. Just a short clip. I just find these fascinating.
Hello everyone, welcome to our channel. This is Wefwafwa Andrew and we are on day 3 of our community outreach. I'm in Manafa district. It's my home district where I come from, and in this community is called Masaka Town Council. Our community here has a population of about 12,000 people, but it has no government facility at all. So people just need to go to the private hospitals for them to be able to test their blood pressure, blood sugar, and many other things. So I thought it wise to come to this place and at least we do something. And this place is actually my home where I'm talking from. My parents' home. Yeah, that's where I come from. It's called the Masaka Town Council. As you can see, we slept here yesterday, and this morning we are preparing to go to the community. We are going to the community where we are going to teach people about hypertension, where we are going to plant also about 370 trees in a single day, starting from this time. And we are also going to give out 6 blood pressure machines. I have divided those people into 6 groups, and I'm going to give those 6 blood pressure machines to them. I have gotten the leaders that I'm going to train on how to use these machines, and I've also bought them books where they will be recording their findings, such that we shall be reviewing after every month or after every week the people who have been helped. And I've also printed out some charts that will help them to interpret those values. As you can see, this is a chart for blood pressure stages. So I'm going to use this very chart, and I will teach them to know how to interpret when it is normal, elevated, high, and when it is hypertensive crisis or an emergency, such that in case they get someone with the alarming blood pressure, they will be able to call me because I've included my number. I have also printed this chart that has a diabetic diet. It shows how someone with diabetes can eat such that the blood sugar will be controlled. So I've put the foods here that are in English, and I've included some words in the local language. So what I'm going to do is that I'm going to leave these charts with all people who are sick. Instead of them hanging the calendars in their homes only, I want them to have these charts. I want people to know how to interpret blood pressure. I will also use this very chart to teach people generally about that. So I'm here with my home people. She's my mother. Say hi. Come here. Yeah, he's one of my brother also. Say hi. Hi. He's my stepmother. Say hi. Then say hi, my brother. So all these guys, we are just a big family. We are a family of around 21 children. So with the time, you will get to know more information about me. Just make sure that you subscribe, get tuned, and follow all the programs. Thank you very much for keeping around. I'll see you after the community. Hello, everyone.
Thanks for Wefwafwa, always fascinating reports. It's very clever. So he's made up all these charts here with the blood pressure on, and people put them on the wall instead of a calendar. And then so much damage can be done if the blood pressure's high and people don't realise that it's high. The same with blood sugar. So he's doing this community screening, and we have talked about this, and he is picking up people with blood pressure who is now treating, and picking up people with undiagnosed diabetes who again is now organising treatment for. So many people in poorer areas, they get qualified themselves and then they clear off to make some money in the city or in America or in England or somewhere. But he's gone back home. Now there's actually 11, that was Wefwafwa's family, but there's actually 11,000 people in that community. And he's actually organised people to supervise and take blood pressures, and is organised like a hierarchy of a triangle that leads back to him for advice. And of course you can always do that in the local culture and the local language. So great programme. Glad to see it's still going well. There'll be links if you want to talk to Wefwafwa below the video or make a donation or whatever. Everything always helps, and thank you for watching today's video.